everyone. So I will be in my intervention here focusing on COVID and in a very specific COVID and actually the violations of sexual and reproductive rights. And I will be bringing some insights from an online survey that we circulated research in a collaboration with the Vecinas Feministas from Latin America last April. The analysis is yet to be published, so everyone is welcome to share their contact with us if they wish to receive the analyses coming from that survey. We received responses from Southwest Asia and North Africa. We also received from Europe, Asia, Latin America, and Africa. And the reason why we're focusing in this webinar on COVID is that it has given us a chance to look at all the exasperated structural oppressions that, I mean, like thousands of feminists and activists and communities had spelled out before over the past years, but yet COVID has given us the chance to actually look at how, in this less than half a year, very stressful and just an understatement, actually, we were able to see and witness how we were all affected disproportionately by the coronavirus. And I'm sorry for the background noise. So I will be actually I'll be picking up from the very last point that Lewa has shared on the prison system and maximizing profit. And before I go there, I actually want to look at what exactly is meant by COVID giving us an embodiment of all the structural oppression, how capitalism, racism, classism, sexism, ableism were really unavoidable for everyone to either experience them all at once or either to be in a very approximate position to witness it unfolding before them. And in the sense, reflecting more on how hunger, gig economy, conflict, gender, and health status became a daily speculation, which is another understatement that I'm using. But also, as we went deeper with the data and looking for more information in the different subregions where we were working and looking, and I'll be focusing, by the way, mostly on Africa, because this is where I've delved the most. It was very explicit that people feared the hunger more than the virus. Despite all the economic measures and all the state responses and national mitigation plans to contain the virus, it did not really reach everyone. So I'll be unpacking a little bit on this. But speaking of prisons, one of the precautionary measures or preventive measures, if you wish, was basically to suspend food parcels and visitations to prisoners and inmates held in detention. In a country like Egypt, for instance, this is one of the ways, visitations is one of the ways where women prisoners can have access to sanitary and period products. So like suspending visitations for over 3 months with no communication at all and not being able to even pass on, I'm speaking in specific also of political prisoners, of not being able to pass on those products, along with how also sanitary, if we have a zoom out of this, is like how sanitary and period products were not something that was thought of as essential product to be dispersed. I mean, like even face masks were not, but like to be very specific on that point, they were not provided for women or made accessible for women and girls or anyone, or any people on periods. So that was one of the things that, again, like under the pandemic, being in prison is not the same. Especially when it comes in under the cover of a precautionary measure. And we know at the same time that in other countries, for instance, in Nigeria, a lot of prison guards clashed with the authorities for not having protective gear. So that also comes as a precautionary measure, and it's the same thing that happened in Egypt, because like the first example I gave was about the situation of prisons in Egypt. And I'm moving from there with how, for instance, the fake news as a measure, like, so we had different levels of precautionary measures coming with COVID. Either it's like an economic measure, or a preventive measure, and with that came a lot of policing, whether from the communities themselves, from neighbors, or from authorities or security forces. So, for instance, just posting online how you, as a health worker, how did you see the COVID situation, or how do you experience them, is being classified as fake news, and that puts you instantly in jail. That was the situation in Egypt and also in other countries, where just posting online has put more of the doctors who are supposed to be at the forefront in prison and still held in detention. But speaking of how the communities as well policed each other around COVID, like in Malawi and in Egypt, a lot of communities expelled and were very and also demonized health workers, either by kicking them out from their houses, or by calling the police on them, or by protesting for having someone who's exposed to COVID cases, for the fact that they just work in a hospital or so, protesting in the premises where they live, and asking them to go. So and in my reading of the survey responses, and also along with my colleagues as well, of course, it's really important to notice that the misinterpretation because of insufficient communication coming from the state has left a lot of people confused for a lot of reasons. One is that the changing nature of the nature of the virus itself, like 1 week in and out, like you have different measures, whether more restrict or more relaxed and eased up. And also at the same time, again, back to the hunger point, like people are being gig workers, and also informal sector workers, or anyone who did not get to have their hands on the economic measures that were set in place by state. We read it in between lines and also in interviews. It was much easier for them, and it was a less risky actually step to take, is to actually venture out and go try to generate an income and feed their children or themselves, instead of just staying home under lockdown where they cannot, where they're starving. So by not having access to those economic measures, people end up breaching the preventive measures set in place, and some of them end up in jail for breaking the law or the emergency state rules, or paying a fine in a time where they don't have access to. And I'll give an example, for example, in Rwanda, where during the lockdown, the public transportation system was put on hold. So healthcare workers had only to take work shuttles designated to transport them from their homes to their point of service. But at the same time, as their work was seen as an essential service that cannot be withheld, care services were not provided as an essential, and was totally and completely overlooked across all the countries that we've looked into and also dealt with in the survey response. So care work then again became the women's the women's responsibility to figure out how to actually juggle this and be able to to be in service and at the same time take care of her children. As we all know, the societal expectation of the woman falls majorly on the woman to take care of her children. So that was another point of intersection where we could easily see how it becomes all of a sudden, with no social protection network in place, it became all of a sudden your responsibility as an individual to figure this out, but at the same time, if you try to maneuver and look at different ways where you can work it out, you end up being in jail or being punished for trying to save yourself. And on that, looking, for example, at how sex workers made it through. So, for example, in Mozambique, with the borders closing down, we've seen how the state has targeted migrant sex workers. So, like, there's again, like, you're fighting in two fronts. Like, sex work has been has been really overlooked, where in places where it was legal to practice and to exercise. But at the same time, as a migrant woman, so no visa services were available, no sufficient communication addressing the sex work communities, for example, in Malawi. So they ended up very confused. They migrated from the streets to the digital spaces, and again, how this exposed them to more violence, moving to the digital space in the mid of a pandemic without knowing, like, if it's a completely foreign territory in the sense, like from the street to the digital space, all the safe and security measures that they would have been practicing, how this has changed with no tailored or actually specific measures and interventions for the sex workers in Malawi. But also the same happened in Burkina Faso. So like with the curfew timeframe set in place, sex workers now had to work during the day. And since they cannot be on the street, they could not be on the street online by night, sorry. That exposed them to more social pressure, given the fact that it is a majority Muslim country, and doing that had put them more at tense and under pressure of their communities, with no protection at all coming from, like, at least the ones that we had access to, no records of how that was dealt with in the specific setting. And also how that affected, for example, access to contraceptives in Rwanda, for example. So in Rwanda, it is subsidized contraceptives, so you still have to pay to have access to contraception methods. That became inaccessible, especially if you're a gig worker, or if you were let go by, you were fired, or you were let go, or your business closed because of the pandemic. So again, how is this affecting women and girls not being able to access contraception? We also know that from some of the testimonies coming from women in Egypt, how they that was one of the things that they dispensed and women themselves didn't look at them as something urgent and essential, and started using a piece of cloth. I'm sorry, I lost you. Okay. There we go. And then I have one instance that I would like to bring in that is actually from Latin America, that is not from Africa. Since I said I would be focusing on Africa, but it is about sexuality under a pandemic. So, for example, the new measure of having a sex-based days in Colombia, Peru, and Panama for men and women to go out on alternate dates during lockdown to fetch essential products. This rule made gender non-binary people and transgender people more prone to aggression and violence, and it also put them in a situation where they were forced to pay a fine for breaching a measure that doesn't see them. And in some instances, like in Panama, for example, there was a high probability for detention. So just going out on the wrong day puts people in jail for a rule that doesn't see them. And I think this is something that is really worth looking at and seeing how also paperwork, and I mean, like, we've been saying this for the longest time now, but like also sex references and sex fields in our identity cards and our paperwork, how it actually becomes a barrier in this instance when the law doesn't see us. So that was one of the things that I also wanted to bring in. But I think that's really one last point is about supply chain being affected by the pandemic and how it affected access to medication for people living with HIV. And also, for instance, like in Egypt, one of the sites where people get actually their medication are fever hospitals. That was in March. So that, and they were, fever hospitals were also sites of COVID screening. And that made them more exposed to social pressure and stigma and actually potential violence. The medication went out of stock for over a week, and there was no communication, official communication coming from the Ministry of Health, for instance, or any agencies that are acting as as stakeholders in responding to HIV and AIDS. And it was not before June that a hotline was launched to answer needs and queries of people living with HIV. So like you have a time gap between March and June where people had no idea what exactly was going on, and it was completely ambiguous. Especially at the time, we did not know of how of the fact that the economy was reopening. So like it had its own impact, I would say, on mental health as well. And I think this is what I would like to share for now, but linked to child marriage. So with the child marriage, in reference to what Dina has been reflecting on. So with child marriage, actually, it is, so I can speak, for example, and reflect about how it was in Egypt. Marriage was one of the things that was looked at as non-essential. So like you would still, like for the most part, at least in the beginning, you wouldn't have any access to, and it's actually one of the other things that came hand in hand when talking about FGM, like how FGM would look like under a pandemic and a virus spread. And it's really difficult to tell by now the repercussions of COVID on child marriage and FGM, because like you also don't have data, like and it's not something new. It's not something with COVID, because like the state doesn't know what to do with this virus. It has to do with how data has been historically made inaccessible. And in this, and I mean by historically, either that like who actually generates data and what is considered data, but also the structural barrier of living in a country where data can only be produced by the government. And the pieces of the data where you have access to are the only one, are the pieces that they think you should know. So I'm not even like speaking at a level of advanced level of like gender segregated data or sex segregated data to be particular. It's really about like not having any sense of what is the situation like for child marriage in Egypt, even before the pandemic. So I think there is a barrier, and I know this is not really responding to how this looks like. But also in the data that we dealt with coming from the survey responses, we haven't really had our hands, because like there are not enough reflections on how SRHR coming through the survey and the interviews that we've conducted in Africa, coming telling us like what it looks like. The loudest was what was considered essential. But again, this is a good question on in terms of like how child marriage and how sexual reproductive rights are seen during COVID. So we don't have data on that. We don't have enough reflection on that. We can't really tell. We know that the essential services are not being available or they're inaccessible for inaffordability reasons. So yes, I think I'll leave it at here, and then like maybe we can do the conversation later more in depth.